this program, they do exactly what our traditional BSN students do in 14 months rather than 3 years. So having to be on top of things, moving, like I said, at a very fast pace. And then the clinicals are different than when you would think of, other programs that you're having to come in person, be in the hospital setting with faculty makes it unique.
With the Accelerated program, we cover all of the disciplines of nursing. We have specialty areas that we go to: mental health, obstetrics, pediatrics, so on and so forth.
The curriculum is set up so in the very first semester of courses, you're going to get hands-on learning experiences over currently 3 weekends in our clinical learning lab, where you'll learn hands-on nursing skills, how to insert a Foley catheter, how to do an IV, how to do an IM injection. And then the following terms moving forward, you will have in-person clinical experiences with our clinical partners throughout the Northeast Arkansas region.
Resources that the students have available to them is our very diversely disciplined faculty. We have faculty that come from all specialties, so we've got plenty of folks that can help the students, tutor the students, and we also do have dedicated student tutors within the BSN program, so that is available to the students as well.
The very first term is kind of the hands-on in our clinical learning lab and foundations of nursing practicum and health assessment practicum. And then all of the other terms, there will be clinical experiences in a variety of different settings. Most of our clinical experiences are here in the Northeast Arkansas region, also exploring some clinical opportunities in Memphis, Tennessee. NEA Baptist, St. Bernard's Medical Center are 2 of our bigger clinical partners, but students get exposure in a variety of settings. Most of their clinical experiences will be in a medical surgical setting, but they also get experience in mental health, obstetrics, pediatrics, critical care, emergency department, surgery. So they get experiences in a variety of areas. So we're really training the students to be what we call a generalist. So when they graduate, they can go work in any of those fields. So our grading scale is different than a traditional grading scale. So the BSN program, a C is 78 to 80. So if a student has less than a 78, that's considered a course failure. And we allow them to have 2 failures. So first failure in the program, they can be readmitted as long as they meet qualifications. After they fail a second course, then they're no longer eligible to be readmitted to the program in any BSN program. Because of the fast-paced nature, all of our faculty have to have virtual office hours. So that's a really great time for students to be able to meet with the faculty if they're struggling with the class. A lot of our faculty are more than willing to meet with students outside of their office hours. So if they're needing a night appointment or a weekend appointment, they try to be as flexible as possible to kind of meet the needs of the student. In that final term, not only preparing you hands-on, real-world experience before you graduate, but also preparing you for NCLEX, which is our national licensure exam that students have to pass to become a registered nurse after graduation. It's definitely doable. We have a lot of student success stories, but it does take a lot of thought, planning, and hard work on the student.
One thing that I want the students to know here is that your faculty will support you. We really enjoy our jobs, and to us this isn't a job, this is a passion. Our main goal is to turn you into the best nurse that you can be and to give the best patient care that you can give.